For me, it's the other medical providers. I still hear therapists to this day be like, "Oh God, never. I can never have somebody do that. It's terrible." And there are all these fears that are propagated in misinformation that I think really is a disservice to the community.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 346. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people just like you. And today I am doing a question and answer. I'm just going to do one question today. I just got back from a little bit of a sort of a mini vacation just with the holidays. Funny enough, I did a Passover celebration and an Easter celebration despite being very agnostic, if not atheist. So that was a lot of religious culture to take in and participate in. But it was good to, get away from the house and see lots of different family and just give myself permission to not work for a while. So as I am reintegrating into the real world, figured I'd take it easy and just do one question this week. Really good question here, though, and we'll be able to get in depth into some information. If you would like to submit a question for the show, please send me an email to duffthepsych@gmail.com. It's the best way to do so. The website is still in progress, but there's a little comment box on the maintenance page if you wanted to send anything there. But email is the most direct way to do that. So duffthepsych@gmail.com. And with that, hopefully you guys are taking good care of yourselves. It's the weather's been all over the place here, from pretty darn hot to gloomy and almost raining again. So I don't know, the world's not making up its mind, and it seems like everybody is having sort of a funky month, to say the least. So hopefully things are normalizing for you wherever you are and whatever you're doing. As always, I appreciate your attention. If you've not left a review for the show yet, please consider doing so. Helps me out quite a bit. And that said, let's get into the question. So here's the question for this episode. It reads, Dear Dr. Duff, thank you so much for the incredible work you do facilitating healing from mental health difficulties on such a large and accessible scale. You're welcome. And that's really good feedback. I'm 25, have bipolar disorder, and have been on numerous medications and combinations of medications since I was 18. While the mania has been under control for a while, the depression and suicidality have persisted. After a recent inpatient stay, my psychiatrist and I both came to the conclusion that it was time to try a higher level of treatment. He recommended either ketamine or ECT. Ketamine will likely be far more expensive, and I would need to ask my family for a lot of financial assistance, which I'd only want to do if it was likely to work much better than ECT. What does the research suggest about the efficacy of these two different treatments? At this point, I will try just about anything. Perhaps an episode comparing the dominant higher level treatments like ECT, TMS, ketamine, neurofeedback, etc. would be helpful to people in a similar position to me. Hope you're well and appreciate all you do. Okay, so thank you for the really great question. I know that we've talked about bipolar on the show quite a bit recently, so I'm not going to go in depth into all of that. This is going to be a bit different, talking about the specific things that you asked. But if you'd like a more basic primer about bipolar, I'd advise you to check out the previous episode or also my social media accounts. I've been doing a lot more posting related to podcast topics on Instagram and Facebook. And specifically, recently I did a post about kind of bipolar simplified, where I go through, it's sort of a carousel post where you can go through information about, what bipolar is, what the treatment rates are, medications for it, different things of that sort. So that's a great primer if you want bipolar in general. In this case, we're talking specifically about the depressive symptoms that you have. As you mentioned, that your mania, manic symptoms are relatively stable and controlled, which is awesome. I did want to say first off that I'm really proud of you for all the work that you've done. I'm sure it seemed like an uphill battle, or sometimes like plugging holes in a leaky boat. You put your finger in one hole and then springs a leak somewhere else, and you go plug that one and it springs a leak somewhere else. It can be really hard to find stability in a situation like yours, but all of your efforts that you've put in have led to all of the gains that you've been able to experience, and your story is far from over. So I really appreciate what you've done so far. You mentioned that you've had a recent inpatient stay, meaning an inpatient hospitalization. So, I'm glad that you were able to get the kind of help that you needed in that case when it was necessary. But this also means that you've been going through it recently, that you've been having a really hard time. So I appreciate you being brave enough to reach out. You and your psychiatrist are talking about higher levels of care for what we call treatment-resistant depression, or sometimes people just call it TRD. So treatment-resistant depression typically refers to depression that has not resolved with other treatments. And there are different ways of defining it, but most psychiatrists and insurance companies will say that TRD is defined as significant depression that persists after trying 2 different antidepressant medications and failing them. Meaning you tried them, they didn't do the trick, you're still having all of these significant symptoms. I'm really happy to hear that your psychiatrist is open to the treatments that you mentioned. For one reason or another, a lot of medical providers, such as psychiatrists, are really hesitant to advise about anything other than just pills, oral medications, SSRIs, and things of that sort for mental health issues. When in reality, there are a variety of other options in addition to or instead of those, such as the ones that you mentioned. So it's great that you have a psychiatrist that's aware of that and ready to help you get that sort of treatment. So what I would like to do is compare and contrast the two treatments that you brought up, which are ECT and ketamine therapy. So let's start with ECT. ECT stands for Electroconvulsive therapy. Now, I wouldn't call myself an ECT evangelist or something like that. I don't think that everybody should be getting ECT treatments, but there are a lot of misconceptions about ECT and a lot of fears regarding the procedure that drive me crazy. The part that drives me crazy is not necessarily people like you who are members of the community that might have misconceptions or concerns about it. For me, it's the other medical providers. I still hear therapists to this day be like, "Oh God, never. I couldn't ever have somebody do that. It's terrible." And there are all these fears that are propagated in misinformation that I think really is a disservice to the community. And I get it. Some of this stems from ECT having a bit of a problematic history, and also from media portrayals of ECT. When you think of electroconvulsive therapy, you think electroshock therapy. You think about these scenes from One Flew Over the Cuckoo's Nest or Return to Oz. She gets it at the beginning of that. And, there are these really sensationalized portrayals of ECT that are intended to scare people. So, of course, it's no wonder that people's perception of ECT is like it's some barbaric treatment. It's scary. It's terrifying. You would never want that to happen to you. In its history, ECT has also been used in some problematic ways. So it has been used sort of as a punishment for people's behavior, like trying to basically burn out behavior that somebody doesn't like, rather than treating a real mental illness. It's been used without anesthesia, which is very hard on the body. It's been used against people's consent or on people that could not provide consent. So yeah, it has a problematic history, as many procedures and many medical interventions do, but we're not there anymore. That's not what ECT looks like now. Currently, ECT is considered to be safe and humane, and it's a treatment that generally has no enduring, lasting, undesirable side effects. It's something that doesn't cause you permanent damage. Electroconvulsive therapy is basically what you get when you break down the terms, right? So electro meaning electricity, convulsive as in convulsions, or seizures. So it's a treatment that uses an electrical current passed through the brain to induce a controlled seizure. Again, it sounds pretty scary, when you just think about the concept of that, but the process itself is very safe. These days, it is done under general anesthesia, so you're not aware of what's happening. You're not there and, experiencing the seizure at full force. You're under general anesthesia, so you don't know that it's happening, and you're also kept from having these violent convulsions. And the methods have been refined over time so that now we can use lower electrical doses and a shorter duration. And so that helps to minimize any side effects. So it's very humane, very safe. With older forms of ECT, there have been concerns of memory loss, whereas the current forms of ECT only feature memory loss as a temporary side effect, and it's something that resolves over time. Now, we don't know exactly why it works, and I don't want that to scare you because, if you actually dig into it and look, we don't know why many different psychiatric treatments work. We don't know why most pills for mental illness work, but we do know that it works. And the clinical literature suggests that the response rate for people with treatment-resistant depression ranges from 50 to 80%. So that's pretty high. And we know that it is an extremely effective treatment for this population, for what you are talking about, depression that's really sticky and doesn't respond to other treatments. Typically, ECT is only used as a treatment when other things have been insufficient, right? So you've tried medications and they haven't worked. But there are some cases where ECT can be used as a first-line treatment as well. These would be things like severe emergent issues like psychotic depression, where you're having hallucinations or severe delusions, or catatonia, which is where you basically can't move. There are a variety of conditions such as depression or schizophrenia that can cause catatonic behavior where everything slows down to the point that you are not even really there. You don't respond verbally. You can hardly move, maybe not feeding yourself, things like that. So in those cases, you can jump straight to ECT in a hospital setting to try to resolve that quickly. ECT is considered to be one of the most effective treatments for treatment-resistant depression. And I mentioned that it's safe, but to put it into perspective, it's considered to be safe enough typically to use on people that are pregnant. So there's no significant risk to a growing fetus if you use it in somebody that's pregnant. Of course, there are exceptions and things to consider, but in general, it is a safe treatment. Now, when it comes to safety, the things to think about are, is there any reason for you and your particular health that you should not be under general anesthesia? Right. So general anesthesia, going under, if you want to say it that way, does provide, some level of risk, and some people have conditions that make that not a good idea. So if that's the case, that might preclude you from getting these treatments. As well, things like a history of stroke or heart attack, uncontrolled blood pressure, these things might make it unwise for you to undergo ECT. But these are all things that you would discuss with your provider. A lot of times with monitoring and adjusting things, these aren't even things that would preclude you from getting the treatment, just things to be aware of and be careful about. Now, regarding side effects, you are going to typically have some amnesia, meaning memory loss, but it's not like you're having permanent memory loss or brain damage. This does not cause brain damage. Essentially, you're going to be foggy in terms of your memories for the period of time surrounding treatment. So the day leading up to treatment, some of the time passing treatment, they call it temporally graded, meaning it gets worse as you get closer to the time of the treatment. Your memory is going to be more missing around that time. But the further back you go or the further forward in time you go, it's going to get better. You can also have some things like confusion, muscle soreness, nausea, or difficulty concentrating. Some people talk about brain fog, but these effects are temporary and you'll see them resolve over time. So once you complete a treatment, it's going to get a bit better. And then typically with ECT, you're doing multiple treatments over time. And once all the treatments are completed, you're not going to see a lasting effect in terms of the side effects like memory loss and such. It's going to be back to normal. You may never recover memories from those specific days that you had the treatments, but that's okay. That's not a big deal. We're not talking about losing memories from earlier in life, and we're not talking about trouble creating new memories. We're just talking about amnesia from having the seizure, which is to be expected. So those side effects, while they might not seem fun, and they're not always fun, it is a higher impact treatment, but it serves a really good purpose, right? We're talking about somebody who maybe might end up suicidal. We're talking about somebody who might be very, very hopeless, might be having their life really controlled by the depression, and the inability to make that depression budge is a primary concern. So some side effects like muscle soreness, a little bit of amnesia for those days that you have the treatments, things like that, it's sort of par for the course and something that's a give or take. So that's kind of the gist of ECT. Let's move on now to discussing what ketamine treatments are. Now, ketamine is an interesting one. It's an anesthetic drug, and it's what we call a dissociative anesthetic. So it's not a hallucinogen. It's not like psilocybin or LSD or ayahuasca or something like that. It's a medication that is meant to reduce pain, and it also causes somebody to dissociate, which means disconnect from reality. We know that the medication is safe. That's not even a question, because ketamine's been used for years and years and years and years and years and years as, first as like a battlefield anesthetic, but also it's been used in surgeries for both humans and animals for years, like I mentioned. So there's tons of data to support the efficacy of it as an anesthetic and the safety of it because it's been used forever. But more recently, we've recognized that ketamine also has a powerful antidepressant effect. So it helps a lot with depression. And in particular, it's been shown to be useful for treatment-resistant depression, which is why it's being asked about here. As well, I've talked about ketamine on other episodes, so I'm also not going to jump into heavy detail about it. Once the website's back up, you can certainly search around there for ketamine. I've done all kinds of episodes discussing it, or on your podcast app, if you look back at previous episodes, there are some episodes about ketamine that I've done. But essentially, what you need to know is that ketamine can be administered in a variety of ways. It can be administered as an IV infusion, where you get a catheter in your arm and they infuse it over time. It can be given orally, and there's a variety of ways for that. It can be kind of dissolving tabs or lozenges even. And it's also commonly administered through a nasal spray. And the reason that it works is not completely known, but we do think that it has to do with glutamate, which is one of the neurotransmitters in your brain. They consider glutamate to be the primary excitatory neurotransmitter, meaning it makes things happen. It's a very active molecule. And so it stimulates glutamate, which has sort of downstream effects on other brain systems, other neurotransmitters, the way that your brain creates synapses, meaning the space between neurons where they're connecting and how your brain is talking to itself. So we think that it's, kind of at the top level, a glutamate thing, and then it has these downstream effects. But one of the major benefits of ketamine is that it's rapid, it's very fast, and it's powerful. It's quite amazing when you see it, because sometimes you can have somebody who is imminently suicidal, someone who has lost hope and they are on their last leg. They go in for a ketamine treatment, and within an hour or two, they no longer feel suicidal. That's amazing, right? So I think that that's one thing to consider, that even if this medication or this intervention may not be the end all be all, it may not be the thing that resolves somebody's depression in the broad sense, just the fact that maybe it could save somebody's life in that moment is incredible and powerful. Now, ketamine is also considered to be safe. It's considered to be safe when it's administered in this way in a clinical setting. Of course, if you grew up in the 90s, you know that ketamine was used and can sometimes still be used as, a recreational drug, a club drug, things of that sort. And typically, that's used at a much higher dose, and it's a lot less controlled. So when we're talking about it being administered in a clinical setting, there are very, very few side effects. The risk of abuse or addiction is also quite low because you're not using that giant dose. You're using a smaller, what you call subclinical dose, right? You basically want somebody to just dissociate, not completely lose all control, not completely have, be completely out of it, because your brain still has to do some work here. But, in terms of side effects, you can have some changes in blood pressure. You're going to, of course, experience dissociation, but that's part of it. And you might feel a little bit out of it for a while afterward, but that's really about it. And so, it's very safe. There are less side effects to be expected, and it's a pretty amazing thing. Now, when it comes to comparing the two treatments head to head, there are some things to consider. One is access to treatment. Since electroconvulsive therapy has been around for quite a while, it's fully FDA approved for this purpose, for depression and treatment-resistant depression. Therefore, it's likely to be covered by insurance. In fact, if you go into your insurance company's website and you look at the details of your plan, behavioral health, and kind of go into where they actually write out what your benefits are, you very well may see electroconvulsive therapy in there as something that is specifically covered. Ketamine itself is not always covered because it's used well, let me explain a little bit that I have before, just for context. Ketamine is FDA approved for treatment-resistant depression only in one form, which is a nasal spray. IV infusions or other forms, they're not FDA approved. That doesn't mean that they're not safe or not effective. It just means that, the government body hasn't said, yeah, we give our gold seal for this treatment for this reason. You're still allowed to get it. It's fully legal, but it may not be covered by insurance. So when you're looking at things like IV infusions for ketamine, you could be looking at several $100s per infusion, and there's the expectation that you're going to do a series of them, 4 to 6 or something like that. So that can certainly add up. As you were talking about, you might need to ask for, financial assistance from your family in that case, which, originally when I first started talking about ketamine years ago, when my wife got her first IV infusions, that's what we had to do. We had to ask for some help with it. And it was totally worth it in the end, but not the cheapest thing. We really had to make something happen there. There are other options. So as I mentioned, there's a nasal spray that's a S-ketamine, so an isomer of ketamine called Spravato. That's the brand name, Spravato. And that's the one that's been APA, or God, I keep saying APA. That's the American Psychiatric Association. A FDA, holy cow, FDA approved. I'm just going to leave that in there so you can hear my brain fart. FDA approved. Spravato is FDA approved for treatment-resistant depression. So therefore, it is often covered by insurance. There are also at-home options such as our recurrent sponsor Mind Bloom. That's an at-home ketamine treatment. And these can be more affordable methods because you don't have to pay for the clinic and the IV and all of that. They can be more affordable than the IV infusions. So what I would say is always check with your insurance, see if something is covered. The nasal spray very well may be covered, but sometimes you can also get them to agree to cover other things. Don't be afraid to advocate for yourself, to let them know, hey, I have tried and failed these medications. I qualify for treatment-resistant depression. This is a research-backed way of treating that, and I would like to see if I can get this covered. So there might be some ways to petition for that, even for IV infusions. It all depends. Regarding efficacy, so how impactful they are, they're both considered to have a high response rate. As I mentioned, ECT is about 50 to 80% response rate, and ketamine is about 50 to 70. So not too different there. And there are pluses and minuses. So one of the benefits of ketamine that I talked about is that rapid action. So going in, feeling depressed, coming out, not feeling depressed. Pretty incredible. One of the detractors of ketamine is that it may have less of a lasting effect than ECT. And so you might be more reliant on maintenance treatments over time. So considering, that you might have to get more treatments, months down the line or years down the line, that can happen with ECT as well. But there does seem to be possibly, more of a need for maintenance treatments with ketamine. There's also just simply a much larger body of evidence for ECT because it's been around for so long. Now, in terms of administration, there are a lot of ketamine clinics out there now. So as long as you don't live too far away from a major city, you're probably going to be able to find IV infusions. The nasal spray is also becoming much more common after the approval by the FDA, but not everybody has easy access to a provider that uses it. So that's something you're going to need to check around and see. With ECT, it's typically done in a hospital setting, and it does require more planning because, as I said, the side effects are a little bit more intense. Even though they're temporary, you're not going to be able to, leave work, go get ECT and go back to work, right? You're going to need to plan around it a bit. You need to be driven there, and you're not going to be fully functional during that treatment. That's different than with ketamine. With ketamine, you're there for the treatment, and within a matter of hours, you're basically back to full functioning. You could go have someone drive you, do your ketamine treatment, have them drive you back. And then within an hour or two, you could be back to, doing some paperwork or cooking for your family or walking the dog, whatever. So it's a lot less impactful in that sort of way. So these are all things that you just sort of need to balance in your mind and think about. For your situation, one thing to consider is that you have bipolar, not just depression. And there is some research that has suggested that, and this is the case for a lot of things, basically when you have bipolar, anything that shakes up the situation can give you some risk here. But there is some research showing certain individuals may experience an increase in manic symptoms. So might have some mania prompted by both ECT or ketamine. I will say this is more common in individuals with rapid cycling bipolar, where you're having, numerous cycles per year, or if you've had recent, recurrent episodes of mania. It sounds like yours has been relatively well controlled. So this is something for you to talk about with your psychiatrist. I think that you would probably, and they'll have to agree or disagree, but probably be a good candidate because your mania has been pretty well controlled. But it is something to consider. It's a possibility that's there. And sometimes it could even be worth it, even if you run the risk of potentially having a bit of mania. So just something to consider with that. They're both totally valid options, and it's going to come down to your specific situation in your life as to which is the most appropriate for you, factoring in things like money, accessibility to treatment, how quickly you need it to work, how, out of it you're allowed to be on a daily basis from these treatments and things of that sort. I've done other episodes talking about TMS, which is transcranial magnetic stimulation, and other approaches, so I'm not going to dive into those in the context of this question. The last thing I do want to say, though, is you brought up neurofeedback at the end as something that you might be interested in hearing more about. So before I wrap up, I just want to address that. Right now, there is not compelling evidence that neurofeedback is effective for depression, and the research there is even more limited for bipolar. People who do neurofeedback will tell you the exact opposite, but look to the clinical data and please be wary when interpreting claims made by neurofeedback clinics because they are definitely trying to make a buck. So just something to think about there. That for some people, they will claim that it works, and if it works for you, great. There's just not a lot of good evidence about it, and the studies that are out there that do have some evidence for its use are poorly designed studies or small sample sizes, and it's just not there. So just think about that. But I really, really appreciate your question, and I want to wish you the best of luck. If you do pick one or the other, please feel free to follow up and let me know how it goes and how kind of what we talked about factored into your decision making. And with that, that's the end of the episode. Pretty short this time. Looks like we're just over 20 minutes. So thank you all for listening. I appreciate you. I think we'll probably be back with 2 questions next week. This has been episode 346 of the Hardcore Self-Help Podcast. If you would like to send me a question for the show, remember you can email me at duffthepsych@gmail.com. And otherwise, take great care of yourselves. I'll see you for the next episode. Bye.